The Physician Assistant Program at the Southern Illinois University School of Medicine utilizes the problem-based learning format as the basis of its medical education curriculum. Problem-based learning is innovative and challenging. Innovative because it is a new way of using clinical information to help students learn. Challenging because it requires the medical teacher to utilize facilitating and supportive techniques rather than directive and didactic ones. For the student, PBL emphasizes the application of knowledge and skills to the solution of problems rather than the recall of facts. It is an approach much favored by curriculum planners in new and more progressive medical schools. PBL is concerned with both what students learn and how they learn it, and uses specially prepared problems, usually written cases derived from clinical experience, as the basis of the curriculum.
Okay, so are you guys ready to start the new case?
Go ahead.
So who wants to read and who wants to write?
I'll read.
I'll do the writing.
So we have Samuel Johnson, a retired 78-year-old farmer.
In a problem-based learning curriculum, students develop the skills necessary to find and critically interpret up-to-date research on real-life medical issues.
So what are some differentials for change of behavior?
So I think dementia, and that's just because it can cause any change in behavior.
Alzheimer's maybe because it can cause atrophy of the brain and also cause change in behavior.
Stroke.
Parkinson's disease.
Neurosif.
In problem-based learning,
Meningitis.
learners are progressively given more and more responsibility for their own education and become increasingly independent of the
Lewy
teacher
body
for their
dementia.
education.
I may
Problem-based
have a brain
learning
tumor.
produces independent learners who will continue to learn in their future careers as physician assistants. The series of problems encountered by learners with this process make up the curriculum. The problems are put together as a group to stimulate learning of content appropriate to the course. In the problem-based learning process, learners characteristically learn far more in areas relevant to their personal
Does the group
needs.
agree?
The learning group is comprised of 6 to 9 learners and a group facilitator. As the group members work together to problem solve and learn, they also acquire collaborative or team learning skills, which are important abilities for working in any healthcare environment. The principal role of the teacher in problem-based learning is that of a facilitator or educational coach, and to provide the educational materials and guidance that facilitates learning.
What questions do you want to ask for the history?
How about Q2, onset? I don't know how long he's had this.
All right, so under onset, it says about 5 months ago, I began to notice that I would forget things. About that time, I sometimes said mean things to my
After the
wife,
chief complaint
and
is
I decided I was
presented,
going to
the
get
students
rich
brainstorm
playing
and
the
work together to
future
generate a broad differential
He also says
diagnosis
I borrowed
list.
against my land
In the
and everything
problem-based
I
learning
had.
process,
Oh, I
learners
was going
encounter
to
a
be
problem
rich.
and
It
attempt to
was
solve
only
it with
because she was
information
white,
they already
and my
possess,
daughter went
allowing
behind
them
my
to
back and
appreciate what they
convinced me
already
not
know.
to lend me the money
The group
that I
reasons through the
didn't
presenting
lose.
problem by asking questions about the patient's history, referring back to their differential list to rule in or rule out those hypotheses.
So based on the information that was gathered in the history, let's go ahead and refine the differentials. Just say up arrow, down arrow, and why, depending on what's the most likely versus least likely from what you've gathered so far.
Well, we can probably up arrow dementia just because his age, we still can't rule it out yet.
So side arrow UTI, and why are we doing that?
Just until we get his vitals so we can actually see if he has a fever.
You don't necessarily have to have a fever to have a UTI.
We should probably start out with getting his vital signs so we can see
The
if
students
he
are
has
able to
temperature.
perform physical exams on the
Find out some
patient
information.
to help further narrow down their differential
Blood pressure,
list.
144
A list
over
of what
90.
needs to be learned in order to complete the
Heart rate,
problem task
60 and
called
regular.
learning issues is formulated throughout the
Temperature
group
is
session.
98.6.
They also identify
what do we
what they
think
need to
about
learn
his
to better
vital
understand the
signs?
problem and how to
Any
resolve it.
abnormals?
I think his blood pressure is a little bit high.
What's a normal blood pressure level for a 78-year-old male?
Didn't they just change the
I
recommendations?
think it's a little higher now.
That sounds like a learning issue.
How about we look at his thyroid? E52?
Neck is symmetric, without masses or scars. Small, non-tender, soft, mobile tonsillar nodes are noted.
So what do you guys think of the physical exam finding for the thyroid?
I don't really know what a normal thyroid exam would find. Does anyone else?
Yeah, so should we make it an LI?
What labs or diagnostics do you want to order to evaluate this patient?
We could get a CBC to look for infection.
I found CBC in the book.
Since modern medicine is constantly changing and updating the understanding, evaluation, and treatment of disease, as well as strategies for prevention and health promotion, healthcare providers need to be lifelong
You
learners.
get thyroid studies, look at TSH.
Okay, so TSH is T1-83.
And what's the normal values for a TSH?
I don't know. So we should probably put that on the board for a learning issue.
Yeah.
Another learning issue?
So based on the history and physical examination findings, plus the lab results that we have so far, what are your top differentials for this patient?
I think that depression should be one of our top differentials just because he's expressed that he's been crying, he's been going out to the barn by himself and just kind of secluding himself. So I think that that is a big one.
I think we should keep dementia up there as a top one as well. He's had altered mental status and he started gambling, which kind of seems like it could be a dementia.
He also stated that he was gaining weight, so I think hypothyroidism maybe should be a top differential. He also, on his physical exam findings, had some dry skin.
So nice work today, guys. Go ahead and split up your LIs and we'll meet on Wednesday.
I'll do thyroiditis.
I can pick thyroid physiology.
Okay, I will do goiter.
Students use self-directed study to research their assigned learning issues. Once they have worked with the problem as far as possible and identified what they need to learn, the learners engage in self-directed study to research the information needed by finding and using a variety of information sources: books, journals, reports, online information, and a variety of people with appropriate areas of expertise. In this way, learning is personalized to the needs and learning styles of the individual.
Welcome back. Why don't we start by having someone give us a summary of the case that we opened on Monday.
Samuel Johnson, a 78-year-old male who came in complaining of a change in behavior. 5 months ago, he noticed that.
Based on your research that you did on your learning issues,
At the group's next session, students discuss their learning issues amongst their group members. The learners then return to the problem and apply what they learned to their work with the problem in order to more fully understand and resolve the problem. They develop flowcharts and concept maps as a way to synthesize the basic science and clinical concept. Synthesis of information gained throughout discussion shapes the action plan, or things that need to be done in order to complete the task.
Iodine deficiency is the
The
most
group
common
orders
cause.
lab tests and imaging to help further narrow the problem list. Once history, physical examination, and diagnostics are complete, the group works together to commit to their final problem list. Finally, a treatment plan and patient education topics are formulated for the patient.
So I know we got the TSH level and it was high, but you said something about the thyroid not functioning.
Problem-based learning is a motivating way to learn as learners are involved in active learning. Working with real cases and what they have to learn in their study is seen as important and relevant to their own lives.
Shut down the axis. So if that's not happening, TSH is going to keep being produced and it'll be high just because there's not enough of this in circulation.
Okay.
Like I was shown over there, since those levels are low, there's no negative feedback, so his thyroid's not putting out enough of the thyroid hormone.
So it's a thyroid problem.
Yeah.
So let's take a final look at the differential diagnoses list, and based on the physical examination, history, and the results that you've gathered from the lab findings, what is the final diagnosis for Samuel Johnson that you guys would say?
I would say hypothyroidism. We have up arrowed on our list. Because of his TSH levels, they were elevated, and his T4 was low, and that usually indicates that the thyroid isn't functioning properly.
I agree, and he's shown some symptoms that could be suggestive of hypothyroidism. The changes in behavior, he's had some weight gain, so I also agree with that.
If we're thinking hypothyroidism, we need to replenish those thyroid hormone levels, so we need to give him a levothyroxine, but I'm not sure on the dosages.
I've got the LI on levothyroxine here, and it says for an elderly patient we need to start at 25 micrograms.
So you diagnosed Samuel Johnson with hypothyroidism. What's some patient education you would give him?
I think a big patient ed on this case is compliance with his medication. We need to make sure he's taking it at the right time each day and with a full glass of water, I think 30 minutes before he eats any meals.
Yeah, and I also read that there are medications such as iron, calcium carbonate, H2 antagonists, and PPIs that he may be taking that can interfere with the absorption of the Synthroid. So just making him aware that he shouldn't take any other medications for 2 to 4 hours before he takes that or after.
He's gonna have to take the medicine for life because it's incurable, but we can treat it.
Let's just take a little time to discuss the group process and give some feedback on yourself and how you did, and also how the group worked together.
After they have finished their problem work, the learners assess themselves and each other to develop skills in self-assessment and the constructive assessment of peers. Self-assessment is a skill essential to effective independent learning. The objectives of problem-based learning is to produce learners who will engage the problems they face in life and career with initiative and enthusiasm. Problem solve effectively using an integrated, flexible, and usable knowledge base. Employ effective, self-directed learning skills to continue learning as a lifetime habit, thinking about their thinking, and continuously monitor and assess the adequacy of their knowledge, problem solving, and self-directed learning skills, and collaborate effectively as a member of a group.